Thank you so much, Svenja, for taking the time, and take it away.
Yes, thank you very much. Can you hear me all right? Okay, I see people nodding. Thank you. I unfortunately have to excuse Ruth Müller today because of health issues. She can't come in person. So I will also take her part of the presentation today. But she sent her greetings to everyone. Yes, and I will take it away. I also will have some co-presenters later, Isabella and Jakob, who will also join us later in the session. And we will be talking about robotics and society. And so we're coming, so I'm a social scientist actually, and with that kind of a rare exemplar in the RIC. So we're really trying to bring in the social science perspective into robotics research and want to share some lessons that we can learn from social science. And I'll start by giving a brief introduction into science and technology studies as the field that we are coming from. And then give some examples of a concrete research project that we conducted, the Responsible Robotics Project. And I'll share some insights into the notion of imaginaries and how that can help robotics think about society. And then there's going to be another project, which is a collaboration with the Caritas that Jakob and Isabella will be sharing later on. So first, science and technology studies. That's a research field that explores the relationship between science, technology, and society. And so it's always this kind of double two-way interaction where science and technology shape society. So the ways that technological innovation changes how we live as a society, and also how we as a society can shape science and technology. So always in these two ways. And very recently, we have this very new excellence cluster at TUM that's called Transform. And this is really about transformative technologies and how they are implicated in societal change. And so when and how do technologies get transformative so they can really change society? And robotics is, of course, one of the examples of that. And so one point that's very important from an STS perspective is that science and technology is always social and political. Because it's done by humans, it's made through social practices and the production of knowledge, and it's also shaped by the way that people use technology. And so there's this very old text in science and technology studies that asks the questions, do technologies have politics? Are technologies political? Because there's also a lot of talk about technologies being neutral tools that we can use. But this very old school text already in the 1980s concluded that yes, absolutely, technologies are inherently political, but they are so in different ways. And I want to give some examples that are given in this text. So one is there's a civil engineer in New York City, or there used to be a civil engineer in New York City, Robert Moses, and he was building bridges for the city and was building bridges to the Long Island beaches. And arguably, as Langdon Winner argues in this text, these bridges were political in the sense that they were using technology or this infrastructure to solve a political problem, namely that many of the people in Long Island beaches were kind of a leisurely resort for the rather rich and white population in New York City. And these people preferred not to have Black Americans in their at their beach sites. And they used bridges in a way to keep certain populations out by building them in a way that the that the underpasses on the bridges were so low that buses couldn't pass through that. And so the means of transportation that were mostly used by Black populations weren't really able to go through these bridges to reach Long Island, basically keeping certain populations, mainly Black populations, out. And so this is an example of how technology can be kind of a politics of other means. In this way, New York City didn't have to say, we don't want Black people in this certain area, because that would have been politically a very uncomfortable statement to make. But by building bridges in a way that these populations couldn't reach these regions by their usual means of transportation, they could keep certain people out. So certainly, and that's kind of one of the provocative claims, certainly not all bridges are racist, but some bridges can be. So as a kind of politics by other means. Then there's another way in which technologies can be political. And one example is when you have nuclear energy versus renewable energy, solar energy, that require very different social regimes to govern them. So nuclear energy really needs this political regime and organization of strong systems of safety and control in order to keep this safe for the population. So you have you need centralized energy production, whereas with solar energy, you can have a different kind of organization of this, where you have way more possibilities for distributed and decentralized agency also for citizens. And this is kind of due to how these technologies can work. So it's inherent to these technologies' characteristics. And then the text also says a third thing about tomato harvesters. So there's this example where in the US, there was a big rollout of new, very big machines, like agricultural machines to harvest tomatoes. And they would really increase the efficiency of tomato harvesting. But they also changed the political landscape in terms of who could engage in agriculture in this way, because it was only the bigger farms that could actually have access to these bigger tomato harvesters. But one could still say that politically, so this is a political effect that leads to monopolization by the means of technology. But you could also say at the same time, you can use also political means to mitigate these effects by, for example, if small farmers maybe unionize and come together in a way that they could perhaps buy these tomato harvesters together and share them in a kind of shared economy. So there could be possibilities for these technologies to be used and also to be beneficial to more people rather than just the big farmers. So this is an example of how technology can be, the effects of technology can be mitigated through political means. But at the same time, with this tomato harvester example, we also saw that there are some things that cannot be mitigated through political means, which is that in these cases, the biodiversity dropped in these areas because these tomato harvesters could really only work with tomatoes that are very firm and have very thick peel, because the harvesters would otherwise kind of squish the tomatoes. And so in this way, it was a necessity, a technological necessity, that only crops of tomatoes were used where these very firm, thick peel tomatoes could be used. And so these are just some examples that have been existing very long in STS to show that technologies and artifacts are in fact political, and they have political properties, but in different ways. And that also means that the social and political meaning of a technology is not only determined by the technology itself, but also by social processes. But it's also not only social processes, but technologies have inherent characteristics that determine their politics or their social consequences. And the potential effects of these technologies are often ambivalent. So most technologies have some positive and some negative effects, and it also depends on who you're asking. And some have maybe very positive effects for some people and negative for other people. And this makes it very important that we look at the practices of imagining or reimagining and co-creating technologies with the people whose lives will be affected. So to include in this political process of technology design those people who will then in the end bear the consequences of how we design technologies. And I want to share with you a very specific project that we've been working on, the Responsible Robotics project here at TUM. And it was a very interdisciplinary research project funded by the Bavarian Institute of Digital Transformation. And it really brought together the expertise from robotics and machine intelligence with ethics and law and science and technology studies. And as I've just introduced, I will be speaking mainly from the STS, the Science and Technology Studies perspective today. But the research we conducted was really in this very interdisciplinary environment. And the project uses an approach that's called embedded ethics and social science. And it aims at integrating the consideration of social, ethical, and legal issues into the entire development process of robotics research. And it does so through very collaborative and interdisciplinary work between social scientists and technical researchers. And specifically, Responsible Robotics was concerned with applications of healthcare robotics. And one central question was how the future of healthcare robotics could look like. So how could different actors imagine the future of healthcare robotics? And there is, for example, politics or public policy. So robots have become a very important part in how the German government imagines the future of healthcare. Be it, for example, that Merkel and Söder are marveling at the newest robot prototype at the trade fair on the future of health, or the German Ministry for Research, Technology and Space promoting a digital advancement hub for health. But then the question is, will our future see robots carrying older people's groceries, like here in the ministry's campaign image? Or will it see humanoid robots performing physiotherapy on a hurt person's arm, as in the scenario that Merkel and Söder are looking at? And robotics research itself, the initiatives have also turned to healthcare as a promising application field of their technologies. Robotics researchers actively think about how their research can be translated into robots that can be used in healthcare settings, building robots of different shapes and with different functionalities. And then we also have the nurses that are important in healthcare. And nurses see themselves faced with the visions of the policymakers and the engineers who expect them to work with the robots in the future. But how can they imagine integrating these technologies into their work, or maybe not? And what do they care about when it comes to the future of their work? So with these brief examples of policymakers, roboticists, and nurses, we see that the future of healthcare robotics is shaped by the visions of those governing, developing, and potentially using these robots. And to describe such a future-shaping vision, STS has developed the concept of imaginaries. And imaginaries are socially and culturally embedded patterns of visionary thought that shape broader societal processes like policymaking, research, healthcare provision. And these visionary thoughts consist of cultural references and narratives and images and myths and metaphors. And the important thing here is that they are performed by humans, by social actors that have some influence on the social discourse. And at the same time, they also have performative effects, which means that they can shape the trajectories of technological and social change by, for example, so these stories can guide technological development or policy decision making, and also the allocation of resources. So it's really the way we imagine the future is really important in how we go about bringing this future about. And I will present 3 empirical case studies of imaginaries of healthcare robotics. And I'll show how our imagination of the future plays an important role in designing robots. And also I want to emphasize the importance of considering a range of different perspectives. And I start with the perspective of public policy. And here I brought a study where Ruth Müller and I analyzed public policy documents about technology in healthcare, specifically in Germany. And we analyzed 22 German public policy documents and about the findings. So the way we've analyzed public policy imaginaries is by identifying recurring elements and storylines within the documents. So together, these storylines make up the German public policy imaginary of healthcare technology. So, and these are mainly the nursing crisis and technological solutions to this crisis, and then storylines of good care and good work. And I'll go through them one by one very briefly. So the nursing crisis is kind of the problem framing of the policy documents. And this story includes a shortage of healthcare professionals, Fachkräftemangel in German. And this shortage is combined with an increased demand for healthcare through demographic change in Germany. And referencing these developments, the documents portray the provision of healthcare as one of the greatest challenges for our society. But the policymakers also assure that Germany is well prepared to master all these challenges. And the solution they propose is technology. And one key term that they use to describe this technology is assistance systems, to refer to the technologies that are supposed to help, for example, healthcare workers and not replace them, but to assist them. And with this systems framing, they really refer to a particular public fear that they anticipate, like the dehumanization of care or of job replacement. And they try to soothe these public fears by calling the technologies that they're advocate for assistance technologies. And this anticipated public resistance or fear is also addressed through the storylines of good care and good work. And so good care is expected to be provided through new technologies and technological solutions. And good care is characterized as the support of patients in accordance with their needs, so supporting their dignity, autonomy, self-determination. And it involves direct bodily interaction and relationship and emotional work. And one slogan we found in these policy documents is that of interpersonal care instead of mere technology. And the document then further elaborates technological assistance offers the possibility of focusing the freed up resources of human work time more on social aspects of care and individualized care provision. The keyword here is rehumanization of care via technologies. And so an implicit idea behind this is that care used to be more human, and somehow technologies can help to make care more human again. And then the storyline of good work, which is very related with good care. It has 2 promises. One is that technology is expected to unburden human care workers and free their time for interpersonal care, so the emotional and the relational aspects of healthcare work. But there's also a second promise, which is the narrative or the promise that new technologies will lead to the enhancement of the value of care of your patients, or the Aufwertung des Pflegeberufs. And so there's this idea that new technologies will render healthcare more attractive. And the assumption is that these technologies will bring new tasks to healthcare jobs, that they will require new competencies, bring new qualifications and new responsibilities to healthcare. And remarkably, they present all these changes as enhancements, but they don't really explain clearly how these changes make healthcare work better or more attractive. They just assume that these will be enhancements self-evidently. But there are some tensions between these 2 narratives, and I want to point out one of them. So the question is, what is it now? Is it more interpersonal care or more technological tasks for healthcare workers? And the policy documents don't really answer the question of how human work time will actually be distributed with the use of more robots or more other technologies. So the imaginary here remains very vague of the policymakers. And so once again, we presented these 4 storylines that are the building blocks of the German socio-technical imaginary of healthcare technology in public policy. And I'll now go on to another perspective, that of roboticists, where we went into robotics labs and a robotics initiative to look at their future visions for technology and for healthcare. And this study explores how imaginaries shape design and user engagement in robotics research. And we do a case study of a specific robotics initiative, the Geriatronics Initiative here at TUM. And we analyze how geriatronics engineers imagine healthcare as an environment for robots, healthcare workers as a set of users, and healthcare practice. And for this study, I and a couple of fellow colleagues from STS and ethics went into the Geriatronics Initiative to observe robotics and robotics imaginaries in the making. So we did observations in robotics labs, interviewed the engineers, and did workshops with them, and also collaborated with them for 3 years. And this study really is supposed to demonstrate that engineers' imaginaries of application contexts influence the work practices that they do. So they influence their research, their design of the technologies, and their user engagement. A little overview of the case study. So this is TUM Mermi's Lighthouse Initiative Geriatronics, mainly based in Garmisch-Partenkirchen. And the goal of the initiatives are retaining independence and social participation of older adults, preserving interpersonal interaction and communication in nursing care, and supporting healthcare workers by alleviating some of their burdens through robotic assistance. And their flagship prototype is Garmi, a humanoid service robot designed to support older adults and their caregivers in daily living, communication, and health monitoring. And now some of the findings. In our geriatronics case, healthcare as an environment is imagined as a particularly complex and human environment. And the researchers told us that healthcare settings like hospital rooms or people's homes are much more messy and unpredictable than the places that robots have previously been deployed, like factory production lines, for example. And this complexity makes healthcare a particularly interesting application area from an engineering perspective. So it allows researchers to work on technically demanding problems such as perception, motion planning, and manipulation in very cluttered and dimly lit and human-populated rooms and healthcare facilities. And it simultaneously frames their work as socially meaningful, for example, by contributing to elderly care. And so healthcare then becomes this dual opportunity for robotics as a site of cutting-edge disciplinary challenges and as a way to demonstrate societal relevance. And at the same time, the geriatronics engineers emphasized the current technical limits that are there in healthcare robotics. So because robots struggle with unexpected situations, many of our interviews argued that human intervention will remain necessary for the foreseeable future, so that humans or healthcare workers, in that case mostly, are imagined as kind of a backup when robot autonomy breaks down, for example, when a robot gets stuck and a human needs to help get the robot unstuck. And this is also a way to promote this assistance narrative that humans will work alongside robots. And here the key point is that engineers' imaginaries of healthcare are co-constituted with their disciplinary priorities. So what counts as healthcare complexity aligns closely with what is interesting, challenging, and fundable within robotics research. And these imaginaries in turn also guide concrete design decisions. Yes, and then we've also looked at how engineers imagine healthcare workers as users. And there are 2 particularly prominent aspects. The first is they see healthcare workers as particularly overburdened and in need of support. And they offer their robots as the support. And for that, they really often invoke this political imaginary of the nursing crisis that we also saw in public policy. And at the same time, however, the engineers frequently imagine healthcare workers as reluctant and hesitant to engage with robots. So this view seems to be shaped by this assumption that healthcare workers may lack the technological knowledge, or they may fear their job displacement. And therefore, they expect healthcare workers to be quite resistant to using robots. And this is particularly interesting because now I'm going to foreshadow to the next study that I'm going to present on later. But in our interviews with healthcare workers, we encountered something quite different. So many of them were very open to thinking about how robots could be used in healthcare. And they were very curious and very, very open and positive. And this kind of suggests that there's a gap between how the future users are imagined by robotics researchers and how they actually relate to the technology. So healthcare workers might actually be way more open than some of us may think. And I told you earlier that engineers' imaginaries have real influence on engineers' work practices, and this is an example of that. So these imaginaries of healthcare workers as being overburdened and also reluctant to use robots, they influence how robotics researchers used user engagement. And one common approach we observe is very strongly framed around the concept of acceptance. And which means in user engagement efforts, they seek healthcare workers' acceptance by educating them about robots or by guiding them through hands-on activities like programming a robot for simple tasks, and all with the aim of letting healthcare workers familiarize themselves with robots. And these efforts clearly reflect a very genuine commitment to outreach and engagement. But we also see how the imaginary of healthcare workers as fearful and tech-averse can limit what robotics researchers can learn from these sessions. So as long as these efforts mainly invite healthcare workers to learn about robotics rather than treating them as experts in their field and inviting their perspectives into the design process, it becomes harder to access the full range of insights that healthcare workers could offer robotics. So now we've seen these two understandings of healthcare as a complex human environment and healthcare workers as reluctant users whose acceptance robotics researchers seek. And they built the basis for the geriatronics team's most prominent imaginary, that of the care assistant robot, very explicitly not a care robot. And this is a robot that assists but does not really take away jobs, and that has sufficient human oversight to function in a complex, challenging environment. And their slogans include support instead of replacement or relieve the burden on caregivers. And we've heard many articulations of this narrative of the care assistant robot, and it often creates this dichotomy between what they call real care on the one hand, to be done by humans, and assistance is what's kind of substitutable through robots. And so in real care, they say there's not really a place for GARMI unless as support for caregivers. And I wanted to understand a little more what they meant by real care. And it comprises what the engineers define as the learned jobs of healthcare workers, which they associate with human values, emotions, empathy, the social side. And in real care, human contact is indispensable. And on the other side of this is kind of the assistance, is what they want to achieve with robots. And here I quote, what we develop is a technical system, and we should actually use it in more of a sense of an auxiliary tool. And that is where we are also taking the path of leaving the social competencies on the side of the human so that there's more demarcation. And they imagine tasks for the robots like fetching things, cleaning, lifting, feeding, or reminding patients, assisting in rehabilitation exercises, or assisting in health monitoring. And so this in this imaginary of the care assistant robot, there's this separation implied between real care and assistance. And the last point about the study is that the geriatronics engineers also went far beyond the mere technical work that they do by also envisioning very wide-ranging changes to the world of healthcare, for example, by envisioning new tasks and qualifications for healthcare workers. So the new tasks include supervising, operating, and instructing semi-supervised systems in a safe way, providing feedback for learning systems, and maintaining the systems or tinkering with them to make them suit their local use context. They are also active in developing new robotics-related teaching modules for nursing students, so that the education of nursing students already gets input from robotics. And they envision even new professions or a new job title within the healthcare sector, namely the robot operator. And now we come to the perspective of the healthcare workers and how they imagine the future of healthcare with or without robots. And here for this study, we looked at how the healthcare workers first respond to the engineers' imaginaries of healthcare robotics. So what do they think about these imaginaries that I've just presented? And then we also wanted to know how they themselves articulate their own visions of the future of healthcare. And we used expert interviews with nursing scientists and scenario-based focus groups with nursing students and practicing nurses. And for these scenario-based focus groups, we sat together with the geriatronics engineers to develop scenarios that are based on actual examples of the robots that are currently being developed. And we tried to gain feedback on these robots from the nurses in our focus groups. And some insights into these responses. Very important first, they were very open and curious towards robots and very positive actually towards the prospect of using robots in the future. But they were also quite skeptical about whether any technology alone could fix the larger structural problems that they see in healthcare. They were also at times a little disillusioned about the usefulness of current prototypes. So, for example, we showed them a video of a robot that was designed to bring water to patients. But when they saw how limited the robot's abilities were and how much human help was still needed to complete that task, they started to question whether the robot's presence would actually be a relief for them in their everyday work. And then they also asked some ethical questions about patient dignity and well-being in the use of technology. And also they were concerned about their professional autonomy, whether they would have to adapt their own work towards the robots so much, and whether that will retain their own autonomy in deciding how they do things. And then they were also concerned about how this affects their own relationship to their patients. And one particularly important point that robotics can learn from healthcare workers is about the multifunctionality of healthcare practices. And one example is the changing of bed sheets. So among both engineers and healthcare workers, the changing of bed sheets was kind of one very frequently mentioned task that is seen as this very time-consuming routine task that might be outsourced to robots very easily. But some of the healthcare workers kind of had a different perspective on that. They emphasized that aside from its sanitary purposes, changing bed sheets also has other functions, and it often provides a meaningful moment of interaction for the nurses with their patients. So if you imagine a nurse is changing bed sheets, and while she's doing that, her hands are busy, but she's present in the room. And this can be a moment for a patient who would otherwise maybe refrain from taking up time of the nurse's busy workday to start talking to her. So if she's there anyway, changing the bed sheets, such a patient may feel invited to share his or her concerns or discuss his well-being. when he otherwise wouldn't, because he doesn't want to take up of any of the valuable time of the healthcare worker. And this shows how important it is to pay attention to what gets lost when we translate complex, multifaceted care practices into machine-solvable tasks. And from healthcare workers' perspective, separating tasks into discrete categories of real care and assistance really flattens the complexity of healthcare work. So it overlooks the relational and communicative dimensions that even the most mundane practices always also have. And it's important to consider how to ensure that nothing essential gets lost. And now to healthcare workers' own imaginaries of healthcare robotics. So their imaginaries are very pragmatic. They want technologies that relieve workload and enhance patient care, but they don't really care about gaining new technological responsibilities. So most of our participants didn't really envision themselves as robot operators. Instead, they imagined robots taking on some assistive tasks like lifting, reporting. Also, they wanted help in documenting the healthcare work and health monitoring. So in a way that they could focus on what they see as the heart of their profession, which is the relational and emotional aspects of care. They also said that robots can be useful if they sustain caregivers' capacity to build meaningful relationships with patients. And the robots need to be flexible and adaptable to the needs that emerge in a given situation. And now to take some conclusions from these three different studies. So imaginaries, even within the same geographic context, so in this case, all of what I've presented was in Germany, and the same technological field, healthcare robotics, imaginaries remain heterogeneous. They are ambiguous and interpreted differently by different actors. And I give it again the example of assistive healthcare robotics. So this imaginary, the very same imaginary and same storyline means different things to different actors. So for policymakers, it legitimizes innovation agendas and projects this very benevolent vision of tech-enhanced healthcare. And roboticists use the systems framing to navigate technical constraints and anticipated resistance. And then healthcare workers too speak of assistance, but they try to reassert the importance of human relational labor. And each group's values and meanings are not necessarily compatible with each other, even though they use the same wording often of assistance systems. And this incompatibility can, for example, be seen when new technical tasks are being promoted as an enhancement of work, while the workers actually see them as additional burdens, or when assumptions that nurses reject technology keep roboticists from actually taking seriously the constructive perspective that healthcare workers can offer them. And some takeaways for robotics. First, technological design is already an ethical and social practice with societal consequences. So the choices made in design, like what tasks to automate or what roles to imagine for the users, or what assumptions to build into interaction models, all these decisions carry normative weight in how the future should look like. And sometimes imaginaries can obscure contextual realities. So robotics often works with these optimistic, policy-driven imaginaries of robots will relieve nurses' burdens. But these imaginaries often abstract away from the realities and the real complexity of healthcare work. And this may misalign with the reality of caregiving. And roboticists should therefore very critically reflect on where their visions come from and question whether they accurately reflect the needs and constraints and values of those living and working in the application environments. And the flip side of this is that recontextualizing imaginaries improves design relevance. So to do so, robotics research should incorporate the knowledge of healthcare professionals, patients, and other stakeholders early and throughout the development process. And doing so can reveal, for example, unexpected concerns or competing values. And if they are taken into account, this helps align the technology more closely with the lived realities in these contexts. And I will close it here. I think we have a little input also by Isabella, who should be there in like 10 minutes. But I think we can already perhaps start discussing this before we give a little input on another project.
Okay, thank you so much, Svenja. So maybe we open up for questions, or people who are online, you can write in the chat. And maybe we start with KIT as usual. Do you have any questions from KIT?
Hi from KIT. So we have a question.
Can you understand me if I speak up like this?
I think we can hear you, yes.
Okay, perfect. I wanted to know if you maybe see or have drawn any comparisons between this like more research focused like interaction between the actual developers or scientists and the different stakeholders, and how it's done in industry by comparison, because I feel like in like software engineering and more industry focused tasks, there is more of like an understanding that is important to take into consideration, like requirements from stakeholders early. Did you like draw comparisons from that?
Yes, thank you for that question. I agree with your observation totally that overall in industry, there's already this, well, necessity to align, if you want to have a product that, and it should be used. Sorry, just some technical issue over here. So if you industry already has to build products that are used, and I think the researchers in at least university researchers can sometimes hedge a little bit and say we're just doing basic research, and we're not necessarily looking at the applications yet. But I think really also the political push currently is so much towards mission-driven and application-driven research that also university research cannot get around looking at how their knowledge that they're producing is being used in the future. But unfortunately, we haven't done any studies that compares industry research versus university research. But I think that would be particularly interesting, honestly, to do in future research to see where there's a difference in this.
Thank you very much.
Yeah.
What is your message for all the researchers that are listening to your call or to your presentation? Should researchers reach out to application users early, or yeah, what is your recommendation?
So I don't know if everyone could hear this. So the question is, what is my recommendations for researchers and whether they should reach out to application possible users early on? And yes, I would say absolutely they should reach out early on. And also it is important to include from the very beginning. And I mean, as early as possible, ideally even before the grant writing process, like before you conceptualize a project, because then is really when you have the most leeway in how to design a project that actually answers questions that are interesting. But also you may need to do early user studies for this, and there it really depends not only on early integration, but also on how you do this. And that was the example of the acceptance studies. A lot of robotics research is framed around this acceptance paradigm, where the idea is or where the implication is really we want to educate users so they accept our products later on. And I think widening the perspective in the sense of really trying to learn more from the perspectives from users is very important, to maybe not only have very standardized questionnaires that ask for how much a person likes a given prototype. It's also important to have more open-ended research. And I think the social collaboration with the social sciences can really help there, to also include, for example, qualitative research, like what we did here with the focus groups, where we really open up for very open discussions, asking wide questions of where do healthcare workers, for example, need assistance, or where do they need something, so that it's really need-driven in the research. But this is a tricky thing, because also as robotics researchers, you want to do cutting-edge, technically interesting research, right? And you want to publish this in the leading journals and conferences. And if you do so, or if you want to do so, the questions that maybe healthcare workers may bring to you might not necessarily be the exact questions that will land you well in these conferences, because they might not technically be so interesting. Yes.
Yeah, because it's a trade-off, right? I absolutely agree with the need-driven part, but I think sometimes people don't know what they need, because and that leads even to big failures in company.
Mm-hmm.
So I mean, you could say, was the smartwatch successful? And the whole, I mean, big investments went into building smartwatches, or did anyone, if you would have asked anyone 2 years ago, you think a chatbot is something that you use on a daily basis? I'm not sure how many would have said yes. Yeah, I find this is, I totally see it for healthcare, but I'm not always sure if people can even imagine what it could be like.
I think that's a really good point. So the question is, do people even know what they need? And which is kind of the implication. Maybe some people who design technologies might have the creativity to think of things that people wouldn't come up with if you just asked them what they need. And I think that's a very good and valid point. And I think then it's more about shaping it as a dialogical process, where these ideas are also discussed very early on, and then co-shaped. But I do think that it's very important to, and also technical ideas. I mean, the creativity that comes from robotics research and what you can do, and also comes from maybe looking at very theoretical, basic research questions. That's always, it's also very important to do that kind of research, because it has always given us breakthroughs that we maybe don't anticipate. So I would argue both is very important. Yeah.
We have a few questions on the chat, so I can maybe read the first one. So that's about the current progress in robotics. So in the last 2 or 3 years, there has been dramatic progress in just humanoid robots. And also in AI in general, we have generative AI and physical AI. And I guess the robots become much more communicative and also get much more impressive physical capabilities. And so I believe the question is if these progresses have any impact on kind of the study that you've presented now.
Yeah, absolutely. I would say that the study results are already a little outdated in a sense, because we've made a lot of progress. And one thing that I didn't really mention in my presentation now, but one thing that some years ago we were talking about in the Geriatronics Initiative a lot was the researchers there back then were often saying, we really want to keep the social aspect and the communicative aspects to the workers and not really include that. And now with the progress on large language models and everything like that, the communicative capabilities have made so much progress, and now people are not really questioning anymore whether this also should be implemented. I think maybe also some others in the room can contribute to this discussion more, but so I would say this policy imaginary with this and this engineering imaginary of we keep the social part to the humans and the robots do the routine tasks is not really, I mean, some of the communicative tasks are really the things that there's so much advancement in recent time, and there we see kind of driven through technologies that these narratives kind of change or need to change. But it makes us also question whether normatively, in terms of ethics, this is what we want, because we used to say the social side stays with the human, but now robots can be such great robots or computers can be such great conversationalists, yeah, who is driving this? And it seems to be, to me, like this is a very technology-driven development right now, with the developments that we have driving or deciding where we are going with robots and what we are using them for. And so will it mainly first be, will many robots then be more for entertainment and conversations and things like that? Yeah, I think we also have a question in the room. I don't know, maybe we take that and then more from the chat.
No, sounds good.
To add, because we talked about future development of robots and how this will change the perception of care workers, for example. I also interviewed care workers, and I feel like they overestimate the ability that robots have. So in their imaginaries, when they talk about robots, they think about much higher abilities already, because they see videos on YouTube, maybe AI generated videos, maybe real videos of humanoids doing crazy stuff. So when you speak to them, they already think that this is all possible. So they're already in the future with their narratives, maybe.
Was this audible in on Zoom?
It would be better if you could summarize it again.
Okay, sure. Yeah, so Jakob here in the room, who will also give a little input, and maybe you can also say more about this then. He said he has worked with healthcare workers and interviewed them and did focus groups with them. And their one finding was that many of the care workers overestimate what robots can do. And so they think robots can already do all sorts of things, and this is also what I meant. They were a little disillusioned with the capabilities in our focus groups, that you also sometimes almost have to educate them that robotics or robots do have their limitations, and they cannot kind of imagine them as something that as machines that can do just anything. And so I think good information there is also very important about what is possible and how we can develop things in a realistic way. And healthcare workers may indeed actually not have a good grasp of what actually is in robotics, which doesn't mean that we only need to educate them. We also need to have a more open dialogue with them, but this is kind of showing what the actual capabilities are currently is important. And that, of course, also goes into this machinery of research and research funding, where you always also as a researcher have to slightly overpromise what you can do in order to get funding, and things like that. So there's really a balance to strike on what to promise and what to communicate, and also where to really emphasize the limitations that there currently are.
Okay, and then we have another question in the chat. So that's about existing prototypes or studies where robots are actually deployed, maybe, and healthcare workers or practitioners are there. And the question is, do you know what the profession is like about the robots?
Yes, so so part of our study was with mainly nursing scientists, so university researchers, but coming from nursing, and many of them also trained in nursing. And these nursing scientists often told us that they have worked with robotics researchers together in collaborative research projects. And that they have worked with some of the prototypes. And what they told us that sometimes one problem that they had was that they felt they were invited to join the research relatively late, when already the prototype was basically developed, all the design decisions were made, everything was determined already, and they were there to evaluate, basically. And there they said this was often too late for them to join the table, and they would have liked to, or they would have suggested different designs, for example. And I've also talked to some, but this is like, I haven't looked into this kind of systematically about what or did a bigger study on all the robotics prototypes that have been tried out in practice. But I've also heard from some practitioners that they had prototypes for a study there, and then these prototypes in the end ended up in the closet and catching dust. So they were used while during the study, but not really taken up. And then there's the question of, did it have to do with the training, that not enough of the persons were trained in how to use them properly? Or did it have to do with the functionality not being what was needed in healthcare practice? So I think there is existing research, but also this is a field that needs much more research.
Okay, any more questions, maybe at Theo Berlin? So no more questions from our side.
Okay, I think then we can also, we have a small input from the Caritas. Do you think, Jacob, you can do that? Isabella is not here yet. I expected her to be here a few minutes ago.
Yes.
Perfect. Maybe she's gonna join.
Maybe you could say from two sides what the idea was.
Maybe you want to come here. I think on the audio is better. Also, you can click for yourself your slides. I think.
Okay. So, okay. So about the project Y of TUM and geriatronics, I can't say so much. That's Isabella's part. I can only say that TUM and Caritas are working together to have this very practical oriented research on robotics in healthcare. And right now, Isabella is focusing a lot on looking at task lists, what care looks like, and what tasks are included in inpatient care. And from my side, I'm looking at more now my master thesis. I'm looking at the outpatient care perspective. But yeah, so care and practice is meant to be put in the center of technology. And as I said, the approach is first of all studying inpatient and outpatient nursing settings and seeing what tasks there are, and second, capturing the relational and situational and emotional part of it. So let me maybe directly skip to my master thesis, because that's where I can say more about. So my name is Jakob Zweigle, and for my master thesis, I'm currently conducting research on the intersection of outpatient care and assistive robotic systems in the context of TUM's Project Y. And as Svenja already mentioned, our goal is to open up a space that is usually a bit unfamiliar to engineers and examine it in all its complexity. And right now, at the moment, most research focuses on, and with care robots, focuses on inpatient care facilities, even though more than 2/3 of the care dependent are cared for at home. So also the question is, will there be enough inpatient capacity to care for an aging society? Probably not. And beyond that, most people want to stay in their familiar surroundings at home. So ultimately, the goal is to enable people to stay at home for as long as possible. And as we already heard from Svenja, with increasing labor shortages and demographic challenges, recent political and scientific debate see a huge potential in technology in general and robotics in particular to ensure in the future good care can be provided. In our opinion, for this to work, it is really essential to involve care workers and their everyday realities into the early development of robots. Two of many reasons. First of all, a normative one. People who do the ground level work should be integrated in decision making, their wishes heard, and their fears taken seriously. And second, we already heard that the nurses will be the end users of such technology. And if it doesn't fit into their work routine, it will end up in the corner covered in dust. So therefore, I asked two research questions that I tried to answer in my master thesis. The first one is how good care is constituted in everyday outpatient care. And the second one is how do the end users see assistive robotic systems? And I really focus on the outpatient, what's special about outpatient care as well, because that's a lot more different than people think from stationary care. And one important point I want to make that the good in good care is not a moral claim for me or for our research, but it is a needs-based one derived from practice. So a nurse told me once in an interview, good care is leaving the patient in better condition than when I found him. So considering the time, I cannot dive deep into my findings, and they're also preliminary, but they are based on observation protocols that I did ethnographically. I spent 1 month with care service, accompanying them, and also I did focus groups interview with care workers that reveal the complexity of their professional role. So I have this little graph here. I won't read everything out, but it shows that according to my observations, a caregiver in outpatient care acts situational in ever-changing environments, and especially in outpatient care environments that are not meant for care. A caregiver acts professional, requires a lot of expertise, and is also very special about outpatient care on sole responsibility all the time. And a caregiver acts supportive rather than paternalistic by promoting the independence of the care dependent. And finally, a caregiver acts relational, often being one of the only human contacts in outpatient care, showing empathy and setting boundaries at the same time. Moreover, I asked them, what do you think about assistive robotic systems? And this overlaps a bit with what Svenja has told us before. Overall, the attitude was quite open. They quickly came up with their own ideas for how this technology could support their work. For example, by assisting with rehabilitation exercises. But where they saw the main advantage in outpatient care settings was bridging the gap between their visits, because they only visit for a few minutes per day, and then people are left on their own. But also skepticism was raised regarding the robot's ability to handle the complexity of care. On the one hand, for example, they mentioned physical barriers in the apartments, but also the situational aspects. They have to do like dozens of micro decisions every minute that maybe not captured if you just have the single tasks and you think, now they're doing this, now they're doing this, that, but they do have dozens of micro decisions every minute. So let me conclude here 2 points I want to make. The first one, good outpatient care is about more than just physical tasks that can be automated. It's situational, supports clients, takes relationships, and balance trusts and boundaries. And the second point that I want to make is that I think assistive robots will come, I have no doubt, and the development will probably accelerate. But how quickly and successfully we can integrate them into private homes largely depends on how we understand and integrate the complexity of the field. That's it from my side. Okay.
I have a question.
Yeah, you have a question.
Thanks, Jacob. I think this is really cool research that you're doing there. And I'm wondering, maybe you can share some of the experiences and your insights, I mean, beyond your more polished insights there. How is it to go into outpatient care? Because this is kind of, now you've made experiences that very few roboticists have, very few social scientists have, unless they do actively do these kinds of research. But do you think this could be something that also that engineers could benefit from, to also like go into the field in this way? I don't know, or maybe can you share how this worked for you? What did you do with the nurses there when you joined them in outpatient care?
Definitely. So the question was that if engineers could profit from it, and what my experience was accompanying outpatient care services. So first of all, for me, it was like a dip into cold water. Like when I came there first, I was like having my protocol sheet with where I wanted to make handwritten notes. The first thing we did was helping people to get on their stockings. We went in, running up the stairs, 2 minutes in the room, out. That was it. First shift, first experience I had with care. So 2 minutes we stayed in the apartment, and then I realized, okay, I can't even take notes in this time. So I can't imagine how a robot could like make this process even faster, like than 2 minutes. But then also you could tell that people, when we arrive, for example, you can see that people have not been drinking the whole day, for example, or that they were forgetting to take their medicine or something. And that's where also I came into conversation with the care workers, where they were like, okay, we see these people like 2 minutes a day. It would be nice if there would be something or someone or a robot to for example, remind them of such things or help them with such things. That's what I meant with bridging the gap between the visits. And yeah, I think it's just something else to read about tasks on paper and how they're meant to be done, or to see how they're actually done. For example, like taking on the stockings, the Stützstrümpfe in German, is like, I've seen like 20 ways to do it. And people are like adapting it to the needs of the patient. They're adapting it to their own, to make sure their own health it benefits from it, and they don't get back pain. So yeah, you can see that one task can be done in so many different ways. So it's not easily to say, okay, this is how we need to automate it, for example, or that you can't even pass each other in some living rooms because it's so cluttered and full of stuff. That's something that really sticks with you when you've been in the room. Also, the hygienic conditions, it's totally different, I think, also to inpatient care. Like inpatient care is standardized and it's kind of clean. Probably, I haven't been there, but it's people live there for rent. But in outpatient care is like sometimes really bad hygienic conditions. Sometimes you come in, you want to shower a person or wash a person, but you have to start cleaning the environment first to start the service, for example. So, and also the conversations just that happen alongside with it. For example, when washing a patient, at the same time they're checking for signs of any illnesses. There's a lot of stuff happening at the same time that can't really be divided, and that they do maybe sometimes also unconsciously with their experience. Yeah, that's some impressions I had. Yes.
Maybe then I have one more question or contribution. I'm not sure. So you said, okay, you ran into this apartment of somebody, put on stockings, went out, and I think this is a story that you also sometimes hear about the conditions of caregiving. That this is really like a standardized, like you have that many minutes for a task, you cannot take longer and things like that. How will it be if robots are involved in this? Will this kind of efficiency mandate basically just be kind of turning faster for the healthcare workers? Then some tasks are maybe supported or automated. How will we ensure that the time that healthcare workers spend with the patients doesn't decrease just as through efficiency gains?
So the question was, I don't know if everyone heard it, that if there will be potentials for efficiency gains through robots in outpatient care. I can't really give a final answer to that, but as I said, 2 minutes of taking on the stockings, I don't think there's a way in the next years to make that even faster with the help of robots, but also some other stuff is already at the limit. Like one care worker told me 15 years ago, they had 45 minutes to shower a person. Now they have, I think, 19 minutes or something left to shower a person. So I don't think there's so much more potential to make all these things faster just by the laws of physics, but or more efficient. But I think that there's other supports. Maybe, for example, when they take the tablets already with the help of the robots, or if they have if they have certain stuff already done, maybe there would be room for visits that are more about relational work. But also care services are capitalist, I mean, industry, so they also need to save money and make money. So I'm not sure if this is a narrative that is maybe, just wishful thinking. Yeah.
Also, I guess a bit provocative question. I mean, is relational work actually, should it be done by a nurse? Or can it be done? Because I mean, it's not a friend, it's not a person from the family, someone who should, of course, should take care that you're physically okay, maybe also mentally okay, in some way, if that is the issue. But is that even the goal one can or should have?
Yeah, I mean, that's maybe also something that was a bit into this thing that Svenja said about there's a big problem, like a care crisis, or also that people are lonely, old people are lonely. And then politics or policymakers have this techno-fix promise that we will have robots, and then there's a rehumanization of care, and we will have more time for this kind of stuff. But yes, as you said, there must be a more like a broader holistic social change, that maybe we have more spaces where elderlies come together, or that against loneliness, because also the care workers, as you may imagine, they come in and they're there for their care work, but they realize, okay, this person wants to talk, but they don't have the time. And that's really hard also for the care worker side, because they have to suppress this feeling of wanting to stay there and then leave. Also, some of them told me that basic documentary stuff like paying the water, paying the insurance and stuff like this, stuff that you would expect from children, for example, that they help their parents to do all the documentation and the everyday things to speak with the doctor and stuff, that they also do that sometimes just next to their normal job because people don't have a social net anymore.
I think what your question points towards a different societal question of like the erosion of family ties and things like that, that often children don't really feel so responsible anymore to be with their parents and to take care of them. And yeah, so I think this is also something that where robotics doesn't really, it's kind of separate from that, or it's another societal challenge that we're facing.
But still, it's hard, like they also can't really separate everything, right? They're still human. So, for example, one time I was accompanying them, there was one woman who lost her husband the day before. And then when we arrived there, like all the care workers came in their free time to condolence her, because they've been in contact for 10 years or something with this couple. So there you can see that care is, I think, always a bit more than just a job, and that it's hard to detach the physical tasks from the emotional part of the care.
And I would agree with that people really build ties with the people that care for them, or I think my grandma has a favorite nurse. So there is something like liking people and getting something personal and emotional out of this. And then the question is, but people tend to do that. Humans bond with other humans that they interact with. But how much will this maybe also affect the way that people interact with humanoid robots? Will they get some of that type of need? Will they try to meet some of that type of need through a robot that they're interacting with if they don't get a human to interact with? And what are the implications there, like emotional bonds to a machine?
Or also humans through the robot, that's also the the thought of the telepresence. Yeah. Thank you for your attention. Maybe you want to talk about.
I think if, unless there are more questions from somewhere, from the other rooms.
Oh yeah,
I have one question here, Theobald.
I have another question. Thank you for your talk. I was wondering if and how the perspective of the patients is different than the perspective of the nurses or caregivers.
Thanks so much for this question. It's a super important one. And this is, I think, I mean, if I showed the three circles of like policy and healthcare and engineering overlapping over one question, and so it's this one. And what's really missing here is another circle for the patients. That is absolutely true. So we haven't studied it. And I think there's also a big gap in the literature, and we lack a lot of knowledge about the perspectives of patients for many reasons, mainly because there are research ethical questions around this, how we can work with vulnerable populations. And so it is more work to get ethics approval for this kind of research, and many research projects that just don't dare to do that kind of research, and which means that many robotic studies then are done with kind of stand-in healthy people, even though the robots are envisioned to be used for vulnerable populations. And I think really research can perhaps also work more with ethicists and psychologists and clinical people to work on ways to bridge this knowledge gap that we have of the perspectives of